we are going to be talking about patient retention now, because the absolute worst thing is when patients drop out, especially since they usually drop out like right before they're done. And it's not like they're almost done enough so that they're not going to regress. It's that they're like right kissing norms, and then they stop, and then they regress, and then sometimes they have to start all over. Sometimes they just go on about their business and say what we didn't work.
Love that one.
Love it.
Didn't work. So as we were learning a lot of lessons and figuring out what works best for keeping patients engaged and keeping patients on track, is that it often seemed like patients would be really excited in the beginning, and parents are willing to like do whatever they want, whatever they need to do to help their kids like get going. And then things would get a little more complicated in therapy, and we'd ask the patients and the families to be doing exercises at home to keep the progress going.
Mm-hmm.
And they would get home and be like, wait, what did they say? What do we have to do? I don't remember. What's going on?
And then it's a fight, because like, no, you were the one in the room. You should remember.
Yes. lots of fighting, and no. She said I had to do it this way. And it's something completely different and easy.
Or the parents are like, yeah, we did it. And then the kids are like, yeah, she just lied to you. Love that.
We didn't do it. Yeah. I remember one kid said, oh, my mom canceled last week and she said that I was sick, but I was fine. She just didn't want to drive.
From the mouths of babes.
Right. And so there's actually, but with that, like, sometimes they do have a lot of things going on, and it is hard to get to the office.
And when sports start, like when the seasons change, that's always tough. Baseball is the big one. That's the one that destroys our schedule.
Yeah. And especially because the games are unpredictable.
Yeah.
It's not even like, they're every Tuesday at 3. It's Tuesday, then it's Friday, then it's Wednesday, then it's all over the place. We figured out that consistency, doesn't have to be in the office all the time.
Exactly. We have to meet the patients where they are. So if we're going to require that they do things exactly the way that we say them to do things, that it doesn't work. And so, we can continue asking them to do the things and having them drop out, or we can make it easier for them to be compliant and make the changes that they came to us for in the first place. They didn't come to us to follow our rules. They came to us for us to help them get better and achieve what's important to them. And so how did we do that?
Well, for one thing, we developed at-home programs that take our in-office special sauce, distill it down so that it's easily digestible and understandable at home. So we do, every time that we assign a homework activity for our patients to do, they know exactly what they're supposed to do at home because they have a video describing it. They have written out instructions explaining it. They have a customized, if they're an in-office patient, they have a customized protocol that they are supposed to follow. And there's no question about, wait, do I do it this way? Did I do it that way? Just follow what's right in front of you.
Exactly. And then if they can't make it into the office for a session, then we can do a virtual session. Like we try to make it so that it's very, very easy to fit into life, because, I have 2 kids and 2 bonus kids, and trying to remember that they need to eat, and everybody, it's just a lot some nights. And it's like, why do you need to eat again? Can we just have wine and cheese like when I was in my 20s?
Right. And honestly, I have one. And it's the same. Last night around 7:30, it occurred to me. I was like, wait, he didn't eat, did he?
Yeah, it gets to be a lot.
Oh gosh.
Yeah. And then everyone wants to have something different, and it's like a whole situation. So to add on, we need to do this 45-minute session, and you also need to practice, and you also need to do your homework, and you also need to practice for a piano, and you need to do this, and you need to do this. Something's got to give.
Yep.
And at the beginning, oftentimes vision therapy gets done, but then around month 2, that's no longer their priority.
Especially when they start to see the progress,
exactly.
Right? That's why they get to almost the end point, because then they're like, but I got better. Everything's good. And what they need to understand is that does not create lasting change. I'm glad you're feeling great now. Your symptoms are resolving. Fantastic. Let's keep that going and let's get past that. So the other component of our home programs and what's changed is that like we really put an emphasis on educating our patients and the parents and the families, because they need to know why we're doing what we're doing and why it's important. And that also makes it more impactful. They can actually like adjust things. If they know that they're working on what we call fixations, or the ability to keep their eyes in one place over time, then they can have a staring contest in the line at the grocery store and be working on their fixations.
Exactly. And like you were saying, when people start to see that their child is getting better, or when they start to get better, it's like, now I can read a book, so I don't need to practice anymore. Or now I don't have double vision, so I don't need to practice anymore. Or now my headaches are gone and I don't need to practice anymore. But they kind of just get to that like threshold, and then everything's just so fragile. And so really kind of explaining that to them, and that's what we do when we have our reevaluations with them. It's like, you're not there yet. You're not there yet. So they actually really understand that, because we need to get to the point where now it seems like your brain's going to continue going in this direction and not revert back to what it's been doing for the past however many years you've been alive.
However many years. That's habit, right? That's
exactly.
It's you can use the metaphors of like weight loss. You still need a maintenance plan if you lose a lot of weight. Braces, you need to put on a retainer afterward. Like you need kind of a contingency plan that you're not just fixed and done.
Exactly. So we had one little boy who came in yesterday, and he had been doing great. Like he was supposed to graduate yesterday, but he's been like really into his VR video games lately. Mm-hmm. He came in a completely different child than I saw 2 months ago. His eye was completely out, and I walked in and I was like, oh no. What happened? What happened? And then what happened was he wasn't seeing double anymore. Before I saw him 2 months ago, we were just like doing the last little push to get him to be done. He wasn't seeing double anymore. He was doing great with school and reading. Everything was good. He was happy. Mom wasn't seeing his eye turn anymore. So then they kind of just stopped. And they weren't doing the homework that we prescribed. They weren't kind of doing anything. And so then a month of doing nothing other than the VR headset. And now we're not back where we started, but we're not where we were before either. And so it's that sort of thing where it's like now to get him back on track to want to do what he's supposed to do after seeing this loss, it's a little bit tricky. So how do we get people to the point of not stopping practicing and also not dropping out because things are better?
Mm-hmm. It's a very good question.
And so what we do here also is we have our kids make their own goals. Mm-hmm. And so when they start vision therapy, we want them to create the reason why they're here. So not what their parents said, not what I said was wrong with their numbers, but like, what is it that they want to accomplish? Because that's something that we can point to when things get hard for them.
That's right.
And so we've had kiddos come in and say, I don't want to get car sick anymore, or I want to be able to play catch with my brother, but don't tell him, like things like that. So it's like they have their own reasons of what they think they can accomplish from coming here. And so when, we're doing an exercise that's particularly hard, we can point them to that. But also we have another wall that says look what I've done. Mm-hmm. Oh, look how far I've come. And so they take their goal from the goal wall to the look how far I've come wall, and then they create another goal. And so it's like they're constantly going towards something because we need that motivation just as people. Then for our adults, we do our whys.
Right. So if you are familiar at all with Simon Sinek, he has a kind of viral talk that he gave about the power of like finding your why, which is essentially like, why are you doing anything? And he came from a perspective of like a business, figuring out what their purpose is and letting a business's goals and decisions be guided by that why. But you can distill it down to every person. What is your why? Why are you doing this? Why is that important to you? And it's not just like, so I can see clearly. Like,
it's not enough.
I can give you glasses. That's not it. Why is it important to see clearly? Why is it important to feel better? Why is it important to actually have some independence? And it's, so that you're not relying on your family to have to drive you around. It's so that you can go back to work and have meaning and a purpose in that sort of situation and, financially contribute to your family. It's, gosh, I mean, there's been 1,000 different reasons, but it's never just, I want to see. And it's never just, I don't want to see double. It's, I don't want to see double because I want to be able to read, because I want to enjoy stories and get lost in this fantastical world again, or, whatever it is. I want to better myself and better my life. There's just so many different reasons, but we can't make that call for them. And we can't assume what their reason is for being here.
And we learned that from a concussion patient that we had. And so she fell down a flight. She was like 30 something years old. She fell down a flight of stairs and got a brain bleed. And after that, she was seeing double. She was having difficulty driving. Her mother-in-law had to drive her to her sessions, and she was barely able to survive the car ride there and everything because she got so nauseous. And she was on our podcast. Mm-hmm. And what she said to us was, "You guys gave me my marriage back."
We're like, wait, what?
Exactly. No, we gave you not double vision. But, she was unable to sit across from her husband when he was eating because the movement of his mouth and how that disconnected with everything she was seeing was nauseating. And it wasn't because she was just nauseated by her husband. It was actually the movement of him picking up a fork or chewing and things like that. She couldn't handle it visually.
Yeah.
She wasn't able to walk down a street holding his hand. All of those things that, we wouldn't come up with if we were trying to help her figure out her why. But after kind of seeing that, for me, I was like, people are coming in here for way, way deeper things than, we realize. And that's helping them figure that out is what keeps them motivated to the end.
Mm-hmm, mm-hmm. I think another thing that actually that same conversation helped me realize too is that, in our view, that patient in particular got to us pretty quickly after the incident.
Shockingly.
From our perspective, she got better very quickly.
It was 2 or 3 months.
It was super quick. And to her, that felt like forever. For her, it felt like she had no answers for 3 months before she found us, before she got to us. She had no answers for 3 months. And then she was in therapy for 2 or 3 months, but that felt like a year.
Because she was every day that I couldn't drive was an entire day I couldn't drive. Mm-hmm. Whereas for us, we're it was 3 months and then you could start driving again.
Woohoo!
So it's very interesting to remember the perspective, and you're not the person who's living with it every day. They are, and that's what we try to express to our referral sources too.
Right.
Because obviously after a concussion, we know that there's a lot of wait and see and give it time and all of those things, but not really fully understanding how much that person is suffering while you're just giving them time and not referring them out to somebody who might be able to cut that time in half, or by a quarter, or by a few days, because she felt every day was excruciating.
Mm-hmm. Exactly. And then when you also think about just keeping patients happy and keeping patients in mind, think about what's actually important to them too. I think for kids, having their own goals and everything like that is very important. But also think about just even within the day-to-day. I'm thinking of one patient, he's a preteen. As far as his mother is concerned, we're here to work on his reading. His reading and his writing is really hard, and he's struggled for a long time. When I talk to the patient himself, he's here to work on his football skills. He is here to be the best quarterback that he can be. He wants to go, for the distance. And so everything that we do, I have to relate it back to, Tom Brady did vision training. You've got the same visual condition as him. Actually, when you really think about it, look at pictures of him. And then
pictures. Yep.
And then he really gets motivated. And I'll have to, incorporate a lot more movement than I would normally for a learning case. I have to do a lot more ball sports than a typical learning case. But also, dude, we're going to sit down and we're going to do this first, because you can't just start out on the field. You got to have your plan. You got to have your plays. You got to know what's going on. You got to have the fundamentals and the basics. Here's your training. Then we can move.
And then also with kids, they like prizes.
Oh yeah.
So,
We got those.
we're not above bribery.
No.
Jessica created a board game, and so that they can win different prizes with different stops depending on how much they practiced. And so, we try to make it as, whatever works.
Enticing. Whatever works.
We try to decrease the barrier to their parents getting them into the office. And so if they know that they might be getting something, that works. So hopefully that gives you some ideas on how to increase patient retention, because as you know, as business owners, if you can't keep your patients in, or patients are canceling last minute and things like that, then that definitely negatively impacts the number of patients that you can help. One, because they're taking up time in your schedule, but also two, because now you're thinking about how to pay your staff as opposed to thinking about how to help more people. So just little things like really have the patients understand why they're coming in, what their gains mean, what we still need to work on, and why. Having them understand a little bit about like the neuroplasticity of the brain, and that we need to have that repetition and have these skills become automatic, not just like barely met. And then incentives are great.
Our thing.
People like them a lot.
Yeah.
And then one of the other things that we've done is we've switched to a monthly model.
Oh, yeah.
So if you have it such that you are able to, transition from a pay per session model to a monthly model, that makes things a lot easier. It makes it easier to have the virtual sessions. It makes it easier to have the digital portal where they have the exercise videos so they know exactly what they're working on. They can stay up to date with their treatment plan even if they're on vacation. And then you also know who's coming into your office, who's not coming into your office, how many staff people do you need on the floor, what person can be assigned to virtual sessions, what person can be doing the digital portal. You can just plan out your practice a lot more. And they don't teach us in school how to be CEOs of a business. They teach us how to be really, really good practitioners. And the CEO part just kind of like comes with it. And then you have to learn a lot on the fly. So we're trying to decrease how much you're learning on the fly. So if you're able to switch to a monthly model where patients can kind of get everything that they came for, that's the way that you're going to have the happiest patients and the happiest staff. And then the happiest you.
People, when they're invested, are invested. Like, really, and it's not just financially, because when that financial investment, of having a monthly membership, when you pay for something and it's actually, something you can feel and touch, then you're going to be more likely to show up for it.
Exactly. And that's what we want to do. We want to make sure that the patients show up for themselves.
Exactly.
Because at the end of the day, that's why they're here.
Yep.
So thank you.